My first experience in Nepal was 2 years ago after the earthquakes. They had had those severe earthquakes, over 8.0 on the Richter scale, and I ended up going a month after and working in an ICU there, and then also going around to other hospitals and trying to help with sort of public health development. I was showing up for 2 weeks, grounding in the ICU, maybe doing a little bit of teaching, but I didn't feel like it was affecting them the way I wanted it to. What I started doing is started giving ad lib lectures to their medical students, to their residents every day during that trip, and then we started thinking about, well, why not do something from an education standpoint? So the Pediatric Fundamental Critical Care Support course is an out-of-the-box course by the Society of Critical Care Medicine that allows ICU physicians to train paramedics, nurses, general pediatricians, residents, medical students, to train them so that they have more comfort, confidence, and better skills to assess, stabilize a critically ill child. We ended up getting a grant to support the implementation of this course in Nepal at Patan Hospital, which is just outside Kathmandu. The course involved 5 faculty, including myself from Helen DeVos Children's Hospital, as well as faculty from Stanford and Northwestern and Southern Illinois. And there was a lot of effort and collaboration between Dr. Sangeeta Basnet, who is a Nepalese-born pediatric critical care physician medicine, as well as Nepalese Pediatric Society, Society of Critical Care Medicine, and Patan Academy for Health Sciences to make this course happen. We ended up getting 30 pediatricians who work all over Nepal to enroll in the course and participate very actively. The 2-day course included lectures as well as skill sessions where they worked on their abilities and confidence to resuscitate a critically ill child, stabilize a critically ill child, and then determine what was the best disposition planning for that child. Out of the course came, I think, really sort of refreshing relationships and an invite to come every year in the future to do the course again, but also we were asked to help them develop a sort of collaborative communication within email so that all these pediatricians who came to this course for the first time could work together and keep in contact with each other. So I think it was a really enjoyable experience. There was a situation where I was giving a lecture on congenital heart disease. I was describing a congenital heart lesion where you need the medication prostaglandin to basically bridge you and stabilize you until you get your surgical repair. And as I was giving this lecture, I was trying to give them a better idea of when you need this specific medication. And then all of a sudden somebody raised their hand and they said, what if we can't get this medication, which is a life-saving medication? And I literally stopped in my tracks because I've never, ever even thought about encountering a situation like that. And so I think little things like that gave me perspective about how many things we have available that we don't even think twice about using. That being said, I think, I also feel like there's a big role within medicine to just focus on education. And that excites me because our hope with this project was to set it up over the first 3 years, go back recurringly to have new courses, and eventually pass it off to one of the ICU physicians that I worked closely with during my time there and have them run with the course. And that's rewarding to me, to know that we did something and we left it in their hands to run with. That just gives me a level of enjoyment that's difficult to describe. But coming back here, I then also think about what are things we can do to enhance our trainees' experience. And my hope is in the future we can take fellows, we can take residents and other physicians on my team and sort of build their awareness of medicine in other parts of the world.